Hi, I'm Katie. I got the online 6 by Dr. Klaus. I've had, I know, 3 sets of crowns, and then after some started breaking and they were deteriorating under the caps and different places, I cried because I didn't know what I was looking at. And I knew that something had to change. And that's when Dr. Mayette said, I want you to go see my friend, Dr. Klaus. He can make it right.
We're really kind of on the verge of having, what we deem a terminal dentition. We are careful with those type patients because we're not exactly sure where their education level is. And it can be a shock when we sit down with a patient and even discuss the potential that she needs all her teeth removed. And somewhere when their education hits a threshold, the light bulb really turns on and they understand, okay, this is what I want.
He's got a little dry wet, I think, and he sat back and he said, pull them. You want to pull them all? Well, I was to the point that if I was going to pull some, why keep a few that were under the caps and being diabetic? They were decaying from where you can't see. That was an easy decision. I knew they would all be alike and they'd all be one color at that point.
She knew she wanted the implants and she knew that she wanted teeth that were fixed. However, she was conflicted over making the financial investment right off the bat. And so giving her the options and giving her, the different treatment options that we have, she first chose to remove the teeth and try a denture.
Dr. Klaus knew that wasn't going to work, but he let me figure it out myself. I think it took me maybe a month to decide this upper denture is not going to work.
I think she reached her breaking point when, one, it was during COVID and she was never wearing them. And so when she did need them one day, she couldn't find them.
At 2 o'clock, that was me on the video on the camera at the house, digging like a raccoon for my teeth. But I told him, I said, I can't do this. Dr. Klaus said, I didn't think you could, but we needed to get to a place where you felt like this is what you would want to do. And they just started working on them. And all I've heard is horror stories about how much implants were. And I thought, I cannot spend close to $100,000. I can't do that. Sell a kidney for that. And he introduced me to the new thing, and the cost was something I could afford.
With a lot of our patients, we see a transformation, and that's really what we live for. That's what we enjoy more than anything, is seeing that light come on, that brightness come back to the patients, and watching her come into our office and interact with us and interact with our staff, it's just a heartwarming thing to be a part of.
When I got in my car, I thought, I can't believe I thought I could wear a false plate when I could have had this for not much more than getting false teeth in that. My husband, and he does not say much, a few weeks ago, he said, you're different today. I said, what do you mean? He said, I don't know, you're just different. Then he told me later, he said, you got your smile back. You're smiling. I know it's a life-changing decision. You gotta know they look good. You don't know they're implants. I would get anybody I knew to at least come have a consult with them. It will change their life.